I told Dr. Genord I was worried about my pregnancy being high risk since I'm going to turn 35. It seems to be in all the pregnancy magazines I'm reading. He explained that I'm not really high risk, but there are some other things to think about now that I'm older. He said all women have a chance to have a baby with a chromosomal problem, like Down syndrome, but that the risk for that increases with my age. He also said there are tests that I may want to do in this pregnancy that I may not have done during my pregnancy with Allison. He referred me to the genetic counselors at Beaumont Hospital.
Genetic counseling is a way to assess an individual's risk for having a baby with a problem. Prior to her genetic counseling appointment, we sent Lisa some forms to fill out, in particular, a comprehensive genetic questionnaire which asks her to describe her and Dave's family histories.
Lisa, I've looked over your forms, and at this point I'd like to draw out a family tree, ask about different family members, and see if there are any conditions that might be inheritable throughout the family.
Okay, good enough.
I'll also ask about her ethnic background. There are genetic diseases that are found more commonly in certain groups, and this could prompt more testing. For example, I'll make sure Lisa was offered cystic fibrosis carrier testing in Dr. Genord's office, since this is screening that all pregnant women, especially Caucasian women, should be offered.
Lisa, your doctor has probably mentioned to you that all women have a risk for a chromosome problem, and as we get older that risk does increase, so I wanted to discuss chromosome abnormalities and a little bit about chromosomes with you.
Okay.
Genetic counseling includes a discussion of how chromosomes are inherited, the common chromosome abnormalities, and ways that we can screen for and actually diagnose chromosome problems during a pregnancy.
Screening tests use a combination of ultrasound to measure the back of the baby's neck and blood work to better estimate the chances that a pregnancy is affected with Down syndrome or open neural tube defects like spina bifida.
I have two questions. One, what if the screening test and the results are abnormal? And two, if the results of the screening test are normal, does this mean I have a normal baby?
If a screening test indicates there is an increased risk for problems, a woman should be offered more invasive testing and may choose to pursue CVS or amniocentesis. These tests are performed by a maternal-fetal medicine specialist. Both CVS and amniocentesis have a small risk of miscarriage, so it's best to go to someone that has experience performing these tests, like the specialist at Beaumont Hospital. These tests are used to diagnose chromosome problems. Amniocentesis can also test for spina bifida. A normal screening test reduces a woman's risk for certain problems, but it does not take away all of the risk. Also, not all babies with birth defects or mental retardation can be detected with a CVS or amniocentesis.
I still really worry about the miscarriage I had, so I don't think I want a test that could cause a miscarriage. Is there anything else I could do to make sure my baby is okay?
Genetic screening and testing are just options. In addition to genetic screening, another non-invasive test we generally offer is a fetal ultrasound examination, like those available at Beaumont Fetal Imaging at 19 to 20 weeks in pregnancy. This test will assess the baby's anatomy to see if there are any major structural birth defects, like a heart defect. When problems are seen then, women often reconsider more invasive testing, just like if their blood screening test shows an increased risk for Down syndrome. But it's important to note that not all babies with birth defects or mental retardation can be detected by ultrasound. We all have a 2 to 3% chance to have a baby born with a problem. We hope Lisa, like so many of our other patients, will have a healthy baby.
I was very nervous about what the genetic counselor would tell me, but I am so glad that I sat down with her and went over everything. Dave and I will talk it over, but I feel pretty comfortable with having serum screening and seeing how that turns out. Do you have a Beaumont doctor?